Good afternoon, good evening, complement of the season according to the time. Okay, today's topic we are going to discuss typhoid fever, and we are discussing this topic under community and nursing. Okay, and this topic is one of the topics under communicable disease in community health nursing for GNM first year and the BSc second year. Now, typhoid, sometimes we have heard about typhoid. What is this typhoid? Sometimes family relatives, they may be having this typhoid, or maybe they may be having some fever and are admitted in the hospital, and the doctor is telling typhoid is there. So that is the topic today we are going to see. Now, what is this typhoid? Typhoid fever is another name for enteric fever. Enteric fever. So we are going to see the introduction. Now, enteric fever is also known as typhoid fever, or typhoid fever is also known as enteric fever. Typhoid fever is an acute illness that is associated with fever, okay, and it is caused by a bacteria, a microorganism bacteria known as Salmonella typhi. Salmonella typhi. In case you are asked what is the name of the bacteria that causes typhoid, Salmonella typhi. Okay, and it can also be caused by Salmonella paratyphi. Salmonella paratyphi. And Salmonella typhi leads to typhoid fever, while Salmonella paratyphi causes paratyphoid. Okay, and it is less severe than the typhoid fever. Okay, now this typhoid fever is one of the major causes of morbidity and mortality. Morbidity means like illness or diseases, okay, ill health, and mortality means death, okay, or dead. So it's one of the major causes of mortality as well as morbidity among the population. Now, this typhoid fever is one of the foodborne diseases, food water-borne diseases. So it's one of the food water-borne diseases. Now, the bacteria, what happens to it? When they are deposited in water or food by a human carrier or a case, then it can be spread to other people. Okay, now this typhoid fever is not only seen in one of the continents, but it can be seen all over the world. Now, according to WHO estimation, they told, according to the research made, more than 21.6 million people are infected each year with the typhoid fever or enteric fever. Okay, now out of these people who are infected, that is 21.6 million people, 62% of these people, they are from Asia or Asian continent, while 35% they are from Africa, okay, that are infected. Now let's look at the definition of this typhoid fever. The definition of typhoid fever. The term typhoid fever or enteric fever refers to a communicable disease that is found only in a man. It is found only in a man. Man only will have the disease. And it includes both typhoid fever, which is caused by Salmonella typhi, and paratyphoid fever, that is caused by Salmonella paratyphi A, B, and C. So when you see S, Salmonella, okay, there, that is one definition. The second definition, you can also choose one of them. It says it is what? An acute generalized infection of the reticuloendothelial system, intestinal or intestine, then lymphoid tissue, and the gallbladder. So it's an acute generalized infection of the reticuloendothelial system, the intestine, the lymphoid tissue, as well as the gallbladder. Now, you may see some differences because this is community health nursing. Okay, now we are going to see the epidemiological determinants. In the epidemiological determinants, we have the agents. So under the agents, we are going to see the host, the reservoir, and the source of the infection. Then we have the host factors. Then we have the environmental and social factors, incubation period, and the mode of transmission. Now, agent factors: how, where, and to whom this infection is going. Now, agent factors means those responsible for causing the disease. So we have the chief host of this agent. Now let's look at it. Typhoid fever mainly caused by the bacterium called what? Salmonella typhi. So it is caused by bacteria known as Salmonella typhi as well as Salmonella paratyphi. Okay? They grow at a temperature of 37 degrees Celsius. Now let's look at the reservoir. The reservoir is a man. Man is the reservoir, or human is the only reservoir. So in this reservoir we have two reservoirs, which can be cases and the other one carriers. When we say cases, no, these people who will present with the signs and symptoms. That person is infected with typhoid and he will present with the signs and symptoms. Okay, fever, headache, whatever type of symptoms will appear, like that the person will present. Then we have the carriers. These carriers, how they are, they will have the disease but no any sign and symptoms. And for these carriers, they can easily transmit the disease to other people. They can easily transfer this disease to other people. Okay? Now, in the cases of case reservoirs, in the case reservoir, what they are trying to tell here is the case is infectious as long as this bacteria appears in their stool or in the urine. Now, these carriers who will present with signs and symptoms, no, they will take their urine, their whatever, and do the lab investigation. Now, if they found stools and their urine that bacteria Salmonella is there, in fact, they can easily transmit the infection. Okay, that is why they said a case is infectious as long as the bacilli appears in the stool or urine of that infected person. Now, these cases can be mixed, mild or severe case. Okay, carrier, they can be temporary or can be chronic. When we say temporary, about 6 to 8 weeks. If it is chronic, is about or more than 1 year. That person will be harboring the disease and they will be persisting. How you are giving the drugs, whatever, they will be persisting, they will be there. They will go into the gallbladder or the biliary tract and hide in that place. That is the microorganism. Okay, now let's look at the source of the infection. The source of the infection, we have two sources of the infection, primary sources and the secondary sources. Now when we say primary sources, that is the original sources, okay, which is the feces and the urine of the reservoirs, which are the cases and the carriers. Now the fecal carriers, they are more frequent than the urinary carriers. Okay, those people who will transfer the infection through their feces, they are more frequent than what from the urine. Okay, then the secondary sources, we have the contaminated water, contaminated food, contaminated fingers, and contaminated flies. So when we say contaminated food, we know contaminated food, contaminated water, contaminated fingers, contaminated flies, we know, because they will lead to the disease, because already contaminated with typhoid microorganisms. Okay, now let's look at the next, the host. Okay, the host, let's look at the age. Any age group can be infected with this, but highest incidence is among the group age of 5 years to 19 years of age. Okay, so 5 to 19 years age group, they are the highest incidence group that can easily get the disease. Next one is the sex. All the sexes are affected, but when we talk about cases, the cases are more in female than in male. Okay, then the second one, which is the carrier. Okay, carriers, when you look at the carriers, is more in female than the male. Okay, immunity. Now, immunity, it depends on. So the body, the antibody can be stimulated by infection or by immunization. That is it. So the body, so somebody's immunity can develop because infection is there. That means that person has gotten the typhoid before. Then later on, the body will develop immunity against typhoid, or immunization is being given or was given to the patient. Then the body will, to the person. Then the body will develop immunity against typhoid. Okay, so this is immunity. Now environmental. In the environmental, remember, see, general hygiene or general sanitation is the key to good living. So typhoid fever is regarded as index of general sanitation in any country. So when we have poor sanitation, most of the people, they will end up with the typhoid. Okay, now second thing you have to remember is increased incidence of this typhoid according to the environment. It can be weather, it can be humidity, it can be the soil, it can be water, all natural resources within the environment. That is what we are talking about. Okay, and the social factors that can affect, that can lead to this disease. Okay, now first one that we told about, July and to September, there will be increase in the incidence. No, during that time raining is there, no, so raining season can lead to the increase of this. Why? Because during that time people who may be defecating outside. Some people know they like to urinate, to defecate outside. So in that, during that time, all those things will be washed away by the water, and it can affect our drinking water, maybe well that is not covered. Okay, and maybe drinking water pipe is been broken, so there will be cross transfer of that water, dirty water, into the drinking water. Yes, or maybe it can be agricultural. We are using that water is coming, no, full is washing and is going into the farm containing all those things. What do you expect? And we are not washing properly and we are not using properly. Yes, that is increased incidence mostly in the June to July and September to September. And sometimes we are using the lake water. Yes, directly we are taking the water. So during that time, all the drinking water we are taking, resources of our drinking water may be contaminated from this rainwater. So this rainwater, what will be? We are taking, we are coming, we are washing our fruits, we are washing the vessels, we are washing many things. But that contaminated something is there. Yes, because it has been contaminated by the bacteria. Next one is, see, this bacteria, what happens to it is, it doesn't only survive inside a human, it can survive outside a human. That is why when they pass the urine or the feces, it can stay for some time, depending on where it found itself, the suitable place for its growth and multiplication. Like when it is found in the water, it can stay 2 to 7 days, but not multiply. But it will not multiply, it will stay there as it is. Okay, when it is in the soil, like soil irrigation, no, irrigated with sewage, like we are using the soil to make agriculture, and sometimes we are taking the dirty water, maybe from the company, maybe from the toilet, whatever, we are putting, no, and making, watering the garden, the garden, or we are watering the farm. What will happen? These microorganisms, they will stay 35 to 70 days without dying. After 70 days, they can die, but they will continue to grow and multiply. Okay, now if it is in the ice or ice cream, they can stay over a month. They will multiply and grow. Okay, and if it is the food, our food, they will multiply also and survive for some time. So now in milk, typhoid bacteria, when they enter into the milk, they will stay for some time. They will not even change the taste of that milk, and they will grow rapidly, easily. They can transmit the disease. Now, the next one is the vegetables. These vegetables that grows in the sewage plant, they can lead to that. Vegetables, no, that grows where we are using the sewage to plant, really, they will have those typhoid. Next one is pollution of water supplies, drinking water supplies. When we polluted that drinking water supply, maybe from the tank, okay, maybe that time they are taking the water, it can be contaminated with that, so we can get open area defecation and urination. People, they will be defecating everywhere, no outside, so this one also can lead to that. Next one is low personal hygiene. Those people with low personal hygiene, it can lead. Okay, next one is health ignorance. Some people, they will have ignorance no regarding their health, they don't know how to take care of themselves. All these things can lead to that. Okay, so this is about the environmental, social and social factors. Now let's look at the incubation period. Incubation period, it depends on the amount of the microorganisms we have taken inside, we have eaten, we have ingested through the food, contaminated water, whatever, okay, or fingers. So if it is less, the less the duration of the incubation period. But if it is more, it can less. I mean, the lesser the incubation period, the lesser we take, the longer the duration period, the incubation period. But if we take more, the lesser the incubation period will come. Like the incubation period mostly is from 10 to 14 days. But sometimes can be 3 days. Maybe we ingested full many, so the duration will come, incubation period will come less. If we are ingesting maybe less, it can take 21 days before the signs and symptoms, the incubation period will appear. Okay, so that is incubation period. Before the signs and symptoms will appear, that is the incubation period. Okay, now mode of transmission, it is transmitted by fecal-oral or from the urine-oral route. So fecal-oral means feces into the mouth, directly we are taken to the mouth, or urine into the mouth, that is fecal-oral route. And this thing can be either directly or indirectly. So directly through the hands, our hands know that is been soiled, contaminated with feces or urine of the cases or carrier. And it can be also indirectly by taking this contaminated water containing this bacteria inside, or contaminated milk, contaminated food, okay, or through contaminated flies. Now remember, contaminated ice creams and milks, they are the rich sources of this infection. Okay, now let's look at how it is. Now the person, whether it is a carrier or is a case, he passes his stool and urine. It will contaminate the water, or it has contaminated the soil, or it has contaminated the fingers, or the flies have taken. Where it's going? Going directly into our food. It can go directly into our water. Okay, the food can be raw food, or it can be cooked food. Raw food, that is uncooked food, like vegetables, fruits, no, okay, all those things. Okay, and the person will take it by mouth. That person who is going to take, he's a well person, he doesn't have any disease, typhoid, called typhoid. So mouth of well persons, this thing will go, and the person will end up with a typhoid. Now for a BSc student and for knowledge purpose, for a GNM, you can go with the science, pathophysiology. Now in the pathophysiology, the moment the typhoid bacteria enter into the mouth, it will reach into the small intestine. Okay, after going to the small intestine, it will penetrate into the mucosa. Mucosa lining is there. Then after that, it will go into the intestinal lymphatics. Okay, the intestinal lymphatics, they will go. Now from the intestinal lymphatics, they will move into the bloodstream. Now from the bloodstream, that is blood system circulation, okay, then they will multiply. They will grow and multiply and increase. That is what we call intracellular multiplication. So will take place. So after this disseminated throughout the body, what is going to happen? They are going to enter again. That is what we have, re-enters into the bloodstream. Then it will lead to bacteremia, and the person will present with the signs and symptoms of typhoid. Now let's look at the signs and symptoms of typhoid. It depends on the weeks and the time. Okay, like in the first week, malaise, headache, cough, sore throat, and this first stage is called prodromal stage. First week is called prodromal stage. Okay, and sometimes the person will present with the headache, abdominal pain, constipation also. Diarrhea will come. Yeah, pea soup like diarrhea the person will present. And this the temperature also will increase. Like how we are stepping the ladder, no? Step ladder fashion raise in temperature 40 to 41 degrees, like that is increasing over to 4 to 5 days. Okay, and the person will be complaining of headache. Now the second week is between the 7 days to 10 days. So mostly the illness the person will present with the hepatomegaly or hepatosphenomegaly. Hepatosphenomegaly means enlargement of the liver and the spleen. The spleen and the liver will be enlarged, but it's going to be mild, not too severe. Okay, now the person also will present with the relative bradycardia. Raw spots also may appear in the second week. Now in the third week, what will happen this is called the typhoid stage. So many things will appear. Even in this stage, the person may have, or this week, the person may end up with the typhoid complications. So the symptoms which appear mostly, the person will end up with the prolonged apathy. The person will have a prolonged apathy. Toxemia will come, delirium, because it's going to affect the nervous system. All the systems will be affected. Diarrhea, disorientation, coma. Okay? And if left untreated, most of the patients, like 5 to 10% of the patients, are at risk of having intestinal hemorrhage. Or they can end up with the perforation of the intestine. Hole will come, like they are making a hole inside the perforation inside the intestine. Okay, now the real complications mostly pneumonia, hepatitis, myocarditis, even sometimes typhoid meningitis will come if it goes into the brain, affecting the meninges, the covering layers, that is layers of the covering the brain and the spinal cord, can lead to meningitis. Okay, it can also affect the layers of the heart, leading to myocarditis, psychosis, osteomyelitis, nephritis, hepatitis, all those will come. Okay, now let's look at the complications. I have just said no, so look at it. Toxemia, DIC, shock, that is the general one, like following the system, general system. So if it's affecting the GIT, most especially at the third or fourth week of the illness, the person will end up with the intestinal hemorrhage. Okay, perforation of the intestine. They have to do the surgery and do some repair. Some they may even die. Okay, neurological, delirium, psychosis, coma, meningitis, all these things I have said. Even sometimes the person can end up with deafness. Yeah. Okay, now look at the signs and symptoms. We can see, look at the raw spots. Can we see the raw spots there? Malaise, aches and pain, high fever. You see typhoid meningitis is there? Chest congestion. Because of that, diarrhea also the person will have. Okay, now let's look at the diagnosis of the diagnosis of the typhoid, enteric fever. How we are diagnosing? So the diagnosis, investigations, we have complete blood count, blood culture, vital tests, stool culture, all we are doing. Okay, urine culture also. And we have new diagnostic test, which is alternative to vital test, is the ideal Tupex test. So ideal Tupex test is there, which is alternative to vital tests. Okay, next, how we are controlling this? So it depends on, it can be cases, it can be in case of carriers. Now let's look at how we are treating the managing the cases. In cases, early diagnosis we are doing. We have to go with the early diagnosis of the patient. The second one, notification of the disease. So we have to notify the people concerned. Okay, in early diagnosis, we know we do the test and whatever. Then after knowing we have, then we have to notify those people and they have to give the treatment. In that, before they have to do the isolation. Okay, we isolated those people like cases because signs and symptoms will present. Now, how we are going to manage this? In the management, we are going to give supportive care, which include maintenance of adequate hydration. We have to give because diarrhea is there, vomiting is there, loss of appetite. They may not be able to eat, and because of our also fever, high fever, the water is gone. Like the person will become dehydrated. Yes, it's losing the fluid. So in that also we have to give antipyretics. We can give to stop the bleed. I mean the vomiting. Sorry, fever. Antipyretics. Yeah, to stop the fever, we can give antipyretics. To give antiemetics, we can give to stop the vomiting. So antipyretics for a fever. Okay. Then appropriate nutrition we have to maintain. Now we have some specific let me say antimicrobial drugs therapy we can give. That is antibiotics, okay, which we can give. Okay, so we have something like chloramphenicol. Chloramphenicol is there, chloramphenicol, ampicillin, amoxicillin, so many. Okay, so in case the person is having resistance to quinolone, quinolone is there, quinoline is there. Okay, if the person is resistant to this quinolone group of drugs, we can go with azithromycin. Cefixime also, ceftriaxone also. Okay, we can go with this. So azithromycin we can give, ceftriaxone. Just 2 drugs is okay. Any one of these if the person is resistant to quinolone or chloramphenicol or any of these. So you can go with this. Okay. Now let's go with the treatment. See the drugs, how it is given and the dosage and the days. Mostly we don't exceed 14 days. Sometimes we can exceed, like who are fully sensitive to like quinolone type of group of drugs. So quinolone type of drugs, mostly if people are resistant to it, we can exceed 14 days to 21 days. Okay, we can give. Okay, example like a chloramphenicol. We can give chloramphenicol to 21 days, 14 to 21 days. It depends. And we are calculating according to the kg, that is weight of the patient. Okay, so that is the table you can see. Sustainable, antibiotics, daily dose, in milligram per kg is coming. What is the days? Okay, this is the optimal, that is the optimal therapy. Now we have alternative. If the person cannot go with this optimal therapy, go with the alternative one. You can make one choice. Okay, just make one choice. Okay, now the carriers. In the carriers we have the chronic carriers. So when the person is in the chronic carrier state, we will go with the ciprofloxacin. Ciprofloxacin for 4 weeks, that is 1 month we are giving. And if the person is having any intestinal hemorrhage or is having typhoid perforation, please we go with the surgery. Where it is affected, we go with it. Okay, we will go for surgery. So sometimes gallbladder, whatever, wherever, like it depends on. Cholecystectomy is there. We can go with laparotomy. So when they open, they will find. Typhoid perforation is there. They will do the joining of. They will cut the intestine. Okay, they will cut and remove that hole and join the intestine together, and they will stitch. Okay, and they will cover. So surgery like cholecystectomy may be necessary in some patients, depending on, okay, whether it is affecting, maybe gallbladder is affecting the biliary tract, it is affecting the whatever. So according to that, they will give. Okay, so next one, diet. We have to go with the diet. Remember, in the diets what we are talking, fluids and electrolytes, please should be monitored and replace it diligently. That if the patient cannot take by mouth water, you can go with their IV fluid. Okay, Ringles is there, it can replace the electrolyte, fluid and electrolytes. If it's not there, we can go with the NS. Okay, full strength Daros because of diarrhea and whatsoever. DS, dextrosaline, also we can give. Okay, oral nutrition also we can give. With a soft digestive diet, we can give in case there is absence of abdominal distensions or ileus. So if the patient is complaining of abdominal distension, please subside the food, or you can give liquid gradually, okay, until the paresthetic movement has come and the person will be able to tolerate. Then you go gradually with the food. Then activity, there's no specific limitation. You can do walking, exercise, he can do. Let the person have full rest. Okay, so if he can move around, allow him some activities also he can do. Encourage him to stay home from work until recovery. Then allow the patient to go outside working place. He can stay and do and take care of himself. They should not go to work or involve with other people until he has recovered, because in that period he can easily infect others. Yes. Okay, next one is control of the sanitation. Control. Now what we are going to do in control of sanitation, protection and purification of drinking water supply. Okay, so we know the purification, no, how we are purifying in large quantity or in small. Maybe it can be in the factory or somewhere else. So we can do that. Then the next thing we have to do is purification of water at home. We can do also. Okay, in small quantity or in large quantity we can do. Chloride is there, we can do. Boiling also is there, we filter or whatever. So many ways of purification. So if we are not able to get the already purified drinking water, we can do that. Next one is improvement of our basic sanitation. Personal hygiene, environmental hygiene, food hygiene. Okay, and also we should not be eating anyhow outside. Promotion of food hygiene. Please do not eat outside anyhow. You have to know who are preparing. If possible, prepare your food at home and have. If we are talking about food or also food, promotion of food hygiene, whatever type of food you have bought or you buy outside, please make sure that, like raw foods, make sure you wash them. You can use salt and water. You put the salt and leave for some times, maybe 5 minutes to 10 minutes. Then you wash and you can have. Okay, because some of these things, they may be harboring, hiding those microorganisms inside. Okay, the next one is simple hand washing. We can go without simple hand washing anytime, so that we can reduce several cases of typhoid. How we are doing, like when going to the toilet, no, the moment we come back from the toilet, please wash the hand. So simple hand washing, we are thinking like simple hand washing is nothing, but it can help in reducing of the severity of this case. Okay, and in this, how we are doing the hand washing, remember, even food, before you touch any food or you prepare, you have to wash. After eating, you have to wash. All your vessels, you have to wash and keep them. Okay, toilet you go, if you don't have the soap sanitizer, like in the natives, they can use the ashes, they can also use the sand, and wash the hand properly and erase with water. Okay, Next thing we are going to see is immunization. Is one of the way in prevention. So we have three types of vaccines in which we use in this immunization. So vaccination recommended. One, there is vaccine or immunization for typhoid. Now in this immunization, there are three types of vaccine, but the vaccination is recommended to those living in endemic area. So it advisably to give those people who are living in the endemic area. And also it's recommended to household contacts. And we have also group at risk, like school going children, hospital staff, so many, okay? And we have those who are attending melas and yatras. All those people, we can give them the vaccines, called the immunization. Now, the three types of vaccines are, one, we have the TAP vaccine, we have the live oral vaccine, and we have the injectable vaccine. So three vaccines are there. Okay, number one, injectable one, typhoid vaccine. We have the Typhim 6 and the Typhivax. And we have the live oral vaccine. We see the Typhoral and the TAP vaccine. Three types of vaccines are there. Okay, so any doubt? If you have any doubt, please you ask the question. So explanation of the vaccine is there. How the injectable one is given is there also. How the oral one is taken, and how the TAP vaccine also is given also is there. Okay, so please stay safe. Stay home, stay safe. Thank you so much and have a wonderful day.